Hi, everyone. This is going to be yet another fun conversation. Welcome to Candid Conversations. I'm Dr. Funke Apolabi. And today we have a relatively, maybe not super, there are a few more controversial topics um, in the world of sleep medicine. But I think this is going to be so good. We're going to be talking about oral ties. And before we hit live, I was just saying that even within the sleep medicine space, there's
Mhm.
still, people on the fence around, oral ties, tongue ties, lip ties, all kinds of ties. And so who better to come give us a better understanding of this phenomenon, condition, as well as the treatments than this incredible mother-daughter duo of brilliant pediatric dentists. If you missed last week's episode, I just have to tell you, go and watch it. You need to watch it. And so this is going to be standing on its own, but again, it's almost like building on some of the things we talked about last week. What we talked about was around, the airway development and the child and things that can be done even proactively to set your child up for success, whether it's in breathing or sleeping or feeding or whatever, right? So today we're going to be talking about a very again, like I said, controversial topic, but I think we're going to leave here enlightened. So really, really, really good to have you both here again, Dr. Krystle and Dr. Lynda. How are you guys doing?
Very well.
Well,
Thank you for having us again.
Absolutely. I'm loving this series we're doing. It's so informational. So let's like jump right in. But maybe just for some people that might be joining us for the very first time, tell us a little bit about what you do, who you are, what you do. Like I said, you're both amazing pediatric dentists, but not just pediatric dentists, like pediatric dentists, So let's have you introduce yourself to our folks here.
again, as you just said, we're a mother-daughter team and board-certified pediatric dentists, especially interested in optimizing the craniofacial respiratory growth area from infancy. And that means that we want to make the child grow the best they can grow so they can sleep well, breathe well, way into adulthood by growing a best foundation for them as early as possible. Just putting it simply.
Yeah.
Awesome. Love it. All right. Thank you. And thanks for coming again. So tell us, what are oral ties? I said oral ties because there seem to be different variations. So talk us through what these are.
Essentially, the areas of connections in the body that's supposed to hold different parts of the bodies together, and sometimes they fail to disappear and they hold a little too tight, and so they parts of the fascia really, and sometimes they become restrictive. And really, then when they become restrictive, that's when they're called ties, and that's when they become a little problematic. But not all ties are supposed to be cut, and that's when people it becomes a little more controversial and why it's a problem for most people. But yeah,
Mhm.
it's important to understand that yes, some of it is fascia, and fascia is movable, but when it cannot move, is when it's restrictive. And when it's restrictive, it's important to understand why is it restrictive, and then be able to know that that function is what's most important, and the function and structure go together, and you have to understand the function to be able to delineate the structure of it as well.
Mhm. Mhm. So what are the types of ties?
Yeah. So typically we have about 7 of them. Again, we all are born with ties, and when they become restrictive, that those tissues that kind of hang in the mouth and don't allow function to kind of manifest and become better, that's when they need to be released. So we have them in the upper lip, the lower lip. We have them around our cheeks. When you have a dimple, that's a kind of tie, actually. So that's an
Really?
extra. Yes, those are actually
That's a cute tie. I think I'm gonna keep mine.
yeah, exactly. You keep that one, and that one is attached to your zygomatic bone, right? So that's different. But you have them underneath your tongue as well. And for the tongue, which is probably they're all very important when they get restricted because they do restrict the growth of the face and they restrict function. But with the tongue, that the tongue function, as we've talked about so much, is so important. It's what helps to develop the palate, is what helps to develop the nasal airway. It's what helps with breathing and sleep quality, right? So there's a cascade of events that could occur if the function is not happening the way it should. And so whenever there's restricted tongue movement starting from infancy, that's going to affect latch and milk transfer, things like that. So, and then just something everyone should just, every time we're going to talk about, remember that the tongue is attached to the tip of the toes through body fascia. So if there's a restriction to your tongue, there's going to be restriction throughout your body, and the programming, the motor programming in your brain and your body is going to start to find ways to compensate in the wrong direction. So that's always something one should think about when thinking about oral ties.
Yeah, that affects all the diaphragms, the diaphragm,
Yes.
the abdominal diaphragm and the pelvic diaphragm. All of it gets affected with tongue function. Yes.
Yeah. So you mentioned that everyone has a tie,
Yes.
but it's not every time that the ties are problematic.
Exactly.
So what predisposes to problematic ties versus just cute ones like mine?
Well, there's so many that reasoning hasn't fully been proven per se, right? The studies and research is still coming out with the reason why. Some say there is a gene that's associated with an increase in restricted oral tissues, the MTFR gene. There's also discussion of during embryologic development, the process known as apoptosis or apoptosis, there's a better word for it. But the incorrect way to say apoptosis, that's when the body is supposed to take away certain tissues in order for the next function to occur. But sometimes that doesn't happen for some people. And that could be due to environmental factors, right? We know things that are happening in our world is affecting how our bodies are developing. So that's where that comes from as well. But there's so many different theories as to why we have them. What we do know is that they're not new. We're just being able to evaluate them better and see their effects clearer now with more awareness. So, but as far as a predisposition, many different reasons. I think where we fit better is just being able to recognize the ones that are restricting function and the ones that need to be taken care of and the ones that just need to be using therapy to help with without surgery.
Yeah, and there's more awareness now as well. And some people compensate better than others. So sometimes you may not know that they have a problem until later on. And again, many parents are becoming more aware. At some point, that breastfeeding was not quite as popular. Many moms were started going to work early, so they were bottle feeding more. Now more parents are aware and they want to breastfeed more, and they start to notice that maybe they're having a little bit more difficulty, and they're more open about discussing the issues that they're having. Unlike even my generation, we had problems, we didn't talk much about it, we kept more to ourselves. Now with social media, parents are more apt to say, hey, I'm having trouble here, who else is having trouble, and things like that. So yeah,
that's you bring up a very important point. Like that, there's an increased awareness, and it does sound like, because even in my training, there were issues with tongue ties, but it wasn't this prominent. But it wasn't as if the prevalence, it doesn't sound like, has gone up. There's just more an awareness. How common? I mean, of course, from your perspective, because this is what you see day in, day out. But how common are tongue ties? Like, would you say if you had an idea?
Well, obviously, we see the people who have trouble, right?
Yeah,
You
yeah.
know, and but I also think that people have been aware because I
Mm,
think that in the olden days, or even where I'm from originally, like the midwives, they know when the babies come out, part of what they do, or the old women in the villages, part of what they do when the babies come out is run their finger under the
yeah,
babies under their tongue just to make
yeah,
sure they can nurse because you didn't have access to formula, so they knew the
yeah,
different things that they had to do with the babies,
yeah,
even like stretching the babies when they were giving them bathing them was what I now understand to be almost like body work for them, trying to take away tension for them to make sure they can feed well. So it was well understood that the tongue was important to feeding babies. So it's probably something very common, but not as well understood as much as
Mhm.
what we're now finding out. But because of the increased awareness, people are now starting to understand it more. But what we're looking for, or what we're trying to make sure people get, is that the tongue is not just for feeding. The
mm,
tongue function is very important for even just our life function, getting to grow the face. Again, it's worth saying again that the face grows from the base of the cranium, and being able to get to the base of the cranium, the tongue has to push up on the roof of the mouth to be able to get to that suture right inside toward the back of the mouth in the back of the head, and be able to stimulate it so that the base it can grow that suture to allow the face to grow forward. And how well we breathe and how well we sleep all our lives depend on how well our faces grow. And so, it's worth saying again, tongue function is important. And does that tongue growing the roof of the mouth grows also your nasal airway as well.
mhm. So, walk us through what kind of issues a parent, a newborn's parent or mom might notice if a child has a problematic tongue tie.
Yeah. Well, the first thing that usually shows up is that trouble latching.
Mm,
There's pain when they're feeding, or the baby just slips off, goes on to latch and slips off the breast, or just can't stay on the breast, or just always wants to nurse and doesn't feel satiated, really. Or they get gassy easily because they can't get a good seal, or they have milk leaking off their mouth, really. So I would say maybe the first, second day, they're trying to sort of kind of get used to one another. It's fair to give them that for them to both learn how to do this new thing. But by that second day, actually, I think after by the third day, and they've gotten lactation help, lactation support, and they're still having trouble, they should really seek help by that
mm,
time, because it's not normal that the baby should not be able to kind of know what to do by that time, because latching is a reflex. It's something that should be natural for a baby to be able to feed itself. Otherwise, it won't be able to survive, really.
yeah.
Mhm.
Yeah, no, that's true. And so typically you would get help. Now, what type of help should I know we talked a little bit about that last week, but just as a refresher, right? You have this child, a baby who's not figuring it out, and mom is already starting to feel overwhelmed and anxious. So what kind of, for that mom who's just like, maybe she was told, depending on who's there with her, oh yeah, just give a bottle and you guys will figure it out. But if she's like, nope, 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 sorry, we listened to Candid Conversation and we talked, and I heard Dr. Dean-Duru say there's help. What kind of help can she ask for?
Well, first you find a good, knowledgeable lactation consultant, IBCLC, that is
Mhm,
very knowledgeable. That's your first port of call. And
mhm.
not the one that's going to tell you, oh, everything is fine.
Yeah,
They say that, find somebody else. And
yeah,
then you're hopefully looking for someone who's knowledgeable in body work. Because
mhm,
again, just getting through the birth process, the
mhm,
birthing
mhm.
process, is trauma itself. And again,
Mm,
we saw trauma in our fascia. And fascia is something that is supposed to just help our bodies move easily. Motion is life. And so with all that fascia, everything could just get frozen. And just through that whole process of trauma, you just don't have the cellular energy. So you need that energy and motion to be able to carry out your duties. And part of that is feeding yourself. So get somebody to get the body moving. And that would be
mm,
someone who can help you make the connection, get the reflexes moving. And that could be a craniosacral therapist or a neurological informed pediatric chiropractor or a cranial osteopath or anyone who understands the neurology and the pediatric part of getting the body moving, and
mm,
then a knowledgeable pediatric dentist who understands function, not someone who's going to say, oh, there's a tongue tie, let's cut it. And
mm,
if you have someone who has access to a non-surgical laser, which the technology is a 1064 nanometer wavelength. It's a non-surgical, it's not a cutting laser, it's a light therapy. And it's a particular kind, it's called baby laser. And it's a laser that softens the fascia itself and allows motion and allows integration of the nervous system as well. Allows it to be able to say, okay, let the body function. Let's get motion first. And then you'll be able to have and say, hey, there's coordination, there's integration, and let's see what this body can do. Let's see what this tongue can do. Before you now, let's know, is it just trauma? Is it just a birth forces? Or is it, how did this baby come out? Or is there actual structural restriction that actually
mhm.
requires that? Or occupational therapists, I forgot that one. So,
Yeah.
Mhm.
yeah.
Right. It's important to understand the reason why you need all of these other providers first to check function and understand the patterns, because the baby has been practicing and doing all types of things in utero 9 months, right? For 9 months.
Yeah.
And the tongue has been functioning starting 4 weeks in utero, right?
Mm,
So that means if it's been restricted, and then other parts of the body's been restricted, and then you have the birth process. Like there's so many sections that we don't think about of how a baby's coming out, and there's been compensation for months, right? And the
Yeah.
body's learned these patterns, and so
mm,
being able to release the bodily restrictions allows for function. And so once you have that function on board, then you actually can see, like I said, where that structural tie or structure, and it really happens. And Dr. Lynda was talking about the baby lace therapy, which is something that we do at our practice that we could talk about as we talk about what to do, what parents should understand. But that allows for a more conservative release, right? That allows for then a better, well-informed, a better experience for the baby, because then their nervous system is actually ready for this. And it's not called a snip. That's anyone who calls it that, that's a bad word. So they'll be ready for the releases, right? Because it's not
mhm.
going to be extensive procedure, because now we removed all the other obstacles to be able to look and see what are we releasing
Mhm.
using a surgical, whatever the person's good at, use whatever tool they're good at using. But I think what has happened and why there's so much skepticism, because people look at the tool first, then the baby, then
Mhm.
everything else, and
Yeah.
that's where the missteps occur. So you actually really do need a collaborative team for this baby, for this child, before and after, because the child has to actually learn how to use the tongue again
Yeah.
once it's released. But it's just better to do it in infancy.
Yeah. Now, for that, maybe that baby that got through, maybe they were told and mom was just not aware of the work you do. She didn't watch this video and has gone home and they are on a bottle, or they struggle through nursing and it was painful and it hurt and maybe she started expressing in a bottle. what are other symptoms apart from the latching that you might see that might make you concerned that there is a, there's a tongue tie involved?
Absolutely.
Probably like later,
Mhm.
outside of that newborn period, or maybe even during that newborn period.
Yeah, it's a great, great question. So, a lot of the other things that we find too is that they're having trouble sleeping or they're noisy sleepers
Mm,
as well. And then when it's time to start eating solid foods, they're having trouble transitioning into eating solid foods.
mm,
Uh, they're very picky eaters as well. And actually, some of them are not even able to hold on to the bottle as well. They're having trouble using the bottle as well.
mm,
And obviously, then we see a lot of crowding. That's when like teeth start coming in. They don't have spaces for the teeth as well,
mm,
and things like that. Yeah. You see, got the gummy smile, those come later as well. Like you
mm,
see the smile and you see mostly gum, and or you start noticing the dark circles under their eyes, and or open mouth breathing and mouth breathing, noisy breathing, and things like that.
Mhm.
You
And
want
then
to
even, I'm sorry, go ahead.
go. Mm-hmm.
I was just
So,
saying, even before they reach past the time where they should have had it in infancy, even during infancy, things like body tension, tight fists, tight
mm,
feet, um, uh, torticollis, that's
mhm.
always a hint that something is going on with the tongue function as well. Torticollis type, just different kind of neuromuscular habits that and tightness and things like that that you may not have thought had to do with a tongue tie or had to do with feeding, but even if they're feeding okay, because yeah, child, about they can compensate well doing that, but other parts of their body, the muscle tone either is hypertonic or hypotonic, like if they're just not coordinated or tongue
Mhm.
function is not coordinated, then that's leading into what Dr. Lynda was saying, those kind of growth issues that seem like for people who are maybe not be informed, like, oh, they grew out of it, but meaning
yeah,
they're growing into other dysfunctions. And that's
yeah.
where during their toddler years, then you're seeing picky eating, you're seeing, or
Mm,
late infancy, you're seeing a lot of the choking and things like that. So we like to, not everything is a tight frenulum, but a lot of things deal with the tongue function, and having that collaborative team helps us see what's mimicking a tongue tie and what's not. And our
mhm,
osteopathic friends will talk about, well, we always bring it back to the neurology. There could have been compression during that birth process,
process.
right? And
Mhm,
especially the compression at the back of the head, and they call it occipital condylar compression. And so something like that could affect your vagus nerve. So your rest and digest, so that's that your reflux, your ability to just calm yourself. Those kinds of things show themselves also that could be possibly leading or possibly being a tongue tie or something to do with tongue function. So
mhm.
it's a variety of lists. That's the
Yeah.
problem.
Great points.
So
Great.
what?
Thank you.
That's great. But tell me how, because a question just came up, that do you see, are there studies showing, like you said, there's noisy breathing. Now, if the tongue is not laying where it should be, you can imagine that it might contribute to some sleep disordered breathing.
Mhm.
But someone just asked on Instagram, do you see any link between tongue ties and either central or obstructive sleep apnea, either earlier or later on in life?
Okay, there is a paper by Dr. Krystle and people out of
Mm,
Stanford that said there's a link between the short lingual frenum and
mm,
sleep apnea, but that's not our expertise really. However, there's been like the clinical or what we see clinically, again, it would make sense. There's a tongue
yeah.
function because a lot of those kids have a high vaulted palate, and they have a high
Mm,
palate, that means that you have narrowing of the nasal cavity. You have narrowing of the nasal cavity. That means there's going to be resistance to airflow. You have
mm,
resistance to airflow. That's going to be difficulty
Right.
breathing. So it just
yeah.
makes sense to me. So
Yeah.
clinically, anecdotally, yeah, we haven't done that research, but that's what we see
Yeah.
locally. So
Yeah, no, and it absolutely makes sense. We do need more studies looking at this. And I feel like what we see in clinical practice is there's a delay from what we're seeing
yes,
before research catches up, you
absolutely.
Exactly.
know? So I think that's really where we're seeing this. That being said, um, and I think this is a great place to say, like, if your child has sleep apnea,
Mhm.
just releasing the tongue tie may not be all they need. And that's, I think this
That's
would be a
not
great time
exactly.
to talk about what are the treatment options for tongue tie release
Mhm.
and when is it indicated, because I don't want people now running off and
Yeah,
releasing every tongue tie, right?
right.
When is it indicated?
Mhm.
I'm not releasing mine.
No,
Um, um,
good.
and what would be the benefits? I think maybe let's talk through some of that. I know that's a lot, but you
Yeah.
guys can handle it.
The most important thing is really a proper diagnosis,
Yeah.
and it should be a very collaborative team effort, really.
Mhm.
And so we're not advising for anyone to just rush out there and just go start releasing their tongue ties, because
Yeah.
there's so many things to consider with it. Because first of
Mhm.
all, you got to make the proper diagnosis. You got to make sure they have a tongue space to be able to
Mhm.
do that. There's some people that you really, before you even do any tongue release on them, you really want to make sure that you absolutely can do that. Some people with Down syndrome, you really, really have to think 2, 3, 4, 5, 10 times before you actually do release their tongue surgically, because you can make things worse for them. So
Mhm.
again, is a proper team uh, diagnosis and collaboration, and then timing of the
Staging.
release, whether they're infants, adults, or children. And also have in place pre-work, like preparatory, and most importantly, even afterwards. Because
Mhm.
just because you have a tongue tie and you just go release it, doesn't mean the tongue understands what to do. You have
Mhm.
to retrain the tongue, because again, just like Dr. Krystle said, it's been doing something one particular way. You have to untrain and then retrain. And most importantly, making sure that you have the neurology in place, you have the cellular energy, and they have made the connection so that the tongue actually knows what to do. So once you get the release done and then neuromuscular retraining to be able to now for it to function properly. And
Mhm.
it doesn't matter. It's not the tool. Is the
Mm.
we don't care what you use for it. Go ahead, Dr. Krystle.
But with the tool, right? If you are going to get finally, you've done all the work that you're supposed to do to get the baby ready, then using like a laser for the release, right? Again, these are just a tool. The tool's not the whole story, but using a laser, if it's in your hands, you know how to use, allows for precise, more a quicker procedure, and is tolerated well. And in our practice, one thing that's changed our approach is using, in addition to what we call a dual wavelength. So in addition to the laser cutting, where you have the baby lace therapy, which uses that laser, it uses like gentle laser stimulation. We know laser energy, light therapy, light energy is useful in our bodies for cell energy and things like that. So that it helps to activate the tongue muscles. It helps to improve the coordination of feeding. It helps to wake up the nervous system and support the tongue mobility. It's helping them learn the effective latch patterns and reducing the tension of the fat. It actually is melting like restricted fascia. So for a lot of, at least we're allowed to, or we're able to avoid frenectomies in babies in at least 30% of our cases, because we're actually able to then get more function on board, and that restriction that was there is not a restrictive tie. But even if we do have to, then you're actually seeing you're releasing. A lot of people have to understand that ties come in many flavors. They look differently. So if you go in with your tool just kind of blindly, or you just see something, you may not release enough, or you may release too much without having a proper understanding. So that baby lace therapy has been such a game changer. We use it on from infants to our adult patients for our releases, and that creates just a better, more conservative, more predictable release. And so but needing the assessment, feeding, breathing function is extremely important. The timing, as we said, is extremely important. Sometimes earlier helps with feeding, but really you can feed a baby with a straw, you can feed a baby with a spoon, all different ways. Having an understanding that the tongue function and tongue posture is more important than actually the feeding. But feeding is what's giving us the hint to what's happening to the baby, right? So in the follow-up, the exercises before, the exercises after, or the pre-work, I don't even like to call it exercises, the pre-work before and after prepares that baby in order to be able to get a conservative.
Neuromuscular re-education.
Yeah, say it again, no?
Neuromuscular re-education.
That's what we call it.
So is that similar to myofunctional therapy, or
it's
is that different?
Somewhat.
It's somewhat, right? So myofunctional therapy is useful, and it's more so for when a child can understand what you're coaching it to do.
Yeah.
So that's different than what the pre-work is for the baby. The pre-work for the baby oftentimes is making sure their nervous system is still on high alert from coming out from the canal. Even just putting a Q-tip along their face and making sure their rooting reflex is working properly or not hyper, right? If it's hyper, you can't cut a baby, right? So there are many different things that we use that encompass different techniques and therapies and things that we teach mom beforehand to get in the mouth. So it's different than, for infants is very different. Infants and under 4 years old is different than myofunctional therapy. But the concepts are similar, but myofunctional therapy is more involved. Yeah.
Okay. Wow, this has been so informative. I now know why I have dimples. We know that all ties are not created equal.
Hello.
We know that there are things that your child may be struggling with right from birth that may indicate there is potentially a tie involved. And we know now that these ties really impact function, and it's really important that we address it. Otherwise, this then becomes things they don't necessarily grow out of. They grow into other disorders, including a dysregulated nervous system. There are strategies and tools that can be used to figure out what exactly is going on, and this requires collaborative effort. It's important to work with people who know what they're doing, because it's not just about snipping. Snipping is a bad word. It's really about restoring structure and function, and then now gentler, less invasive approaches to releasing a tongue tie, but does involve work before and work after. Otherwise, it doesn't. It makes an excellent procedure just not look so good. Fantastic way to end. Tell us where we can find you, because I think you guys have brought a very compelling opinion around. It doesn't sound as controversial anymore coming from you. So y'all see this is what my daughter she's gonna be swirling right now. So where can people find you?
So our website, we're Ashburn Children's Dentistry, and also a preventative or our integrative factor or integrative section is called Room to Grow Wellness. And our website is www.kidsmile.com. You can find us on Instagram as well, Ashburn Children's Dentistry. And LDD likes to say the good old phone, 703-723. Oh, no, I'm giving my cell phone. 703-8440.
Amazing, amazing. Well, this was
Yes.
fun. I think we have, guys, if again, this is one you want to bookmark, you want to share with that mom who has a cranky, screaming baby and can figure it out, who's feeling guilty about breastfeeding, or, that picky eater, that kid that seems to have a dysregulated nervous system. This is just something to consider. Again, we don't know your child. Your child deserves to be treated by their own doctor, but this is information that can empower you so you know exactly what to ask your child's doctor. Or if you get to that point where you think, okay, we do need someone to help look at these sleep issues more critically if you have a child or you are struggling with sleep issues. That's what we're here for at the Restful Sleep Please. So give us a call, 215-607-8297, or check out our website at therestfulsleepplease.com. Thank you so much, Dr. Krystle and Dr. Lynda. This is so good.
Thank you.
Awesome. Thank you so much for joining. And we'll be back. We'll be back. This is not
We're
the
so
end.
grateful. Thank you so much.
We're building a story here. You're so welcome. So stay tuned. And until next time, I hope you rest well.